and understanding about the pathways. We've got our guest, Dr. Mandeep, as well here. And we've got Alan and few other two candidates as well, Dr. Vishnu and Dr. Maitli, who'll be talking after Dr. Mandeep. So he is a FRACP doctor and he's medical oncologist. He's quite specialist. So I think whatever I can say, that's a bit less. He knows more about it. So I'll hand it over to Mandeep as well. And then Dr. Mandeep, I'll hand it over to you, please, if you can start.
Can you hear me well? Can everyone hear me well?
Yes.
Yes, doctor.
Okay.
Hi, doctor. Yes.
All right. Thank you. Thanks, Kush, for the lovely introduction. So I can take it from there. So is the audience mainly people preparing for AMC? Are they mostly overseas or in Australia?
So it's all of them all together, Dr. Mandeep, because they've registered from all parts of the world and we don't know exactly. Few of them are in MCQ courses with us, few of them are in clinical, and few have no idea about it. They are from India as well.
Okay.
We have a lot of registration and I hope a lot more will be joining in as well.
Yep.
So there is Alan as well, Dr. Mandeep. When you want to give a bit of a break, he wants to do a bit of an introduction for 15 minutes as well, whenever you have time. But then I'd like to start it with you because we've introduced them that you'll be giving them more knowledge about the pathways. And
Okay.
the doctors, you're most welcome to please write down your questions in the chat box. I'll be happy to read them. And once he's finished and Dr. Mandeep, after he said what he really wants to deliver, then we can answer all of your questions as well.
Amazing. Thanks, Kush. So one thing I can also say is that, I have the meeting chat open. So if someone wants to write a question in between, I can read it and answer it accordingly. Okay, rather than, just write it and this meeting chat is open for me. Okay. So my name is Mandeep. I'm originally from India.
Mandeep, I think I'm going to talk first, then I'm going to go.
Yeah, no problem, Alan. All good.
Because I've got to go to another appointment.
Sure, Alan.
I'm sorry,
All right.
Mandeep.
No, all good.
So how are you, Mandeep?
I'm good.
Congratulations.
Thank you.
Yeah, well done.
Thanks, Alan.
Yeah.
Mm-hmm.
So I won't be long, Mandeep.
Yep.
So it looks like Mandeep's going to talk before the two girls, is it, Kush?
Alan, you do it with the two girls, and then because you're just going to take 15 minutes, it's up to you when you want to take.
The two girls are going to talk after Mandeep.
Okay.
All
right. Then I'll call both of them after Mandeep's
done.
No,
they're here in the office with me.
Okay.
First, would you like to start, Alan? So that
yes, sure. Hi everyone, how are you? So I'm Alan.
Hi, hello.
So I've been doing these courses for a long time. Some of you I can see there that I know already. And so you know me. Anyway, I've been doing it for more than 30 years. Plus also I've been teaching with local medical students as well. So I've got experience across both. But what I wanted to talk about today, I'll let Mandeep and the other overseas doctors that are going to talk to you about all of the different possibilities. I just want to tell you that that the situation is good in relation to either passing the exams or getting jobs in Australia. 30% of the medical workforce are IMGs in Australia, so it's huge. Okay, it's not just a little. If you pull the IMGs out of the Australian workforce, it would fall apart. So they're a very important component of hospitals and general practice in Australia. Very big, and a big, large percentage, 30% is huge. So before, a number of years ago, people that didn't have English, or if you didn't have MCQ, if a hospital wanted you could get employed, but that's not the case anymore. What the case is that you need to pass your English assessment unless you're from a place where that they recognise that you'll get an exemption, and you need to pass MCQ. So once you've passed your English and you've passed your MCQ, then you've got options because you can be registered. And many, many doctors do pick up jobs with just MCQ these days. This has all happened since COVID because of the shortage of doctors. So many doctors are getting jobs with just MCQ. But there are many, you can't just get a job. You think that the hospitals will come chasing you and looking for you for a job. That just doesn't happen. You've got to be organised. So, but once you've got this MCQ out of the way and your English out of the way, you can either think, I'm going to apply for a job, I'm going to do a clinical course or prepare for the clinical exam and sit the clinical, or I'm going to do both, or I might be wanting to apply for a workplace assessment hospital, which is also another option. But you can only do these after you've passed your MCQ. So then that means also to have any chance of getting a job in a hospital or general practice, your CV needs to be excellent. Not just average, excellent. And I'm telling people this when they ever do any of our courses. I always tell them this, but then I have people come back even after they pass their clinical. Alan, I've applied for many jobs and I can't get a job. First thing I'm going to say, show me your CV. Then I show them, I look at their CV, and their CVs, some of them are appalling. No chance of getting a job. Your CV is like your business card. So it needs to be good, and it needs to be putting everything in there, whether you've done courses in Australia, all of what you've done in your country of origin, and it needs to be prepared in a professional manner. And then you need to think about referees. You can, of course, it's easy to get referees from your country of origins, but you need to have some referees from here. Just today, I've done 2 CV reports, two referee reports. One is for a registrar's position, and one is for an intern position. So all of these positions, whether it's from an intern to a HMO, to a registrar, an unaccredited registrar, or a GP, all of these are available to you once you've passed your MCQ and you've got your English. It just depends on you. So then once you've sorted out your CV and you've met the criteria, then you need to be proactive. And I think Dr. Mandeep can talk to you about that, because I know when he was first looking for a job, now he's an oncologist. When he was first looking for a job, he applied for hundreds of jobs because he was teaching here at the same time. Okay, until you get that first job that you get is probably the most important job that you're going to have. Because I'm sure all of you, once you start working, you'll just progress. And you'll go up the pathway. So when you first get your job, you're going to start with temporary registration. Then only after working, and that temporary registration will usually last for about 4 years. After about 2 to 3 years, if you haven't passed your clinical, the APRA will start hassling you to make sure you get your clinical out of the way. But you'll start off with temporary registration. Then only after passing the clinical exam and after working for more than 12 months, then you become fully registered. Okay, then you're the same as any other doctor here in Australia. Every year, depending on what you want to do, the hospital will advertise to you who wants to be a surgeon, who wants to be a physician, who wants to be an obstetrician gynecologist, who wants to be a GP, and then you can apply to get into one of those training programs. By that stage, you'll have worked for at least 12 months in the hospital, so you might be able to get some consultant or professorial support for your application. But you might, because all these specialist areas are all very, very competitive. So then you'll need to apply, and you might have to apply a couple of times before you actually get into it. But we've got many, many doctors that have gone on to be specialists in all the areas. So it's really up to you. But one of the things I wanted to point out to you is that the hospitals or clinics won't come chasing you. You have to chase them. And that means you need to have a good CV. If it's not a good CV, a very professional CV, you can forget about it. And you need to have referees. And you need to have some referees from your country, but you need to have some referees from here. And I know all of you haven't worked here, but you still have to get them from here. And more often than not, the referees that are here will be the ones that are contacted. I also wanted to tell you that, I mean, we do our course. I don't want this to be a session where we're advertising our courses, but any courses you do with IMGs, you know you get CPDs. And the CPDs, you can't do much with them unless you're working like as a GP. There are RACGP approved CPDs. But you can add that into your CV as well. Under the blurb that you've done about what you've been doing here, you can put down this is the equivalent of so many RACGP CPD hours. And when it comes to the stage where you're asking for your registration with APRA, APRA might even ask you, what CPDs have you done before you get your registration? And often they might expect you to do at least 100 CPD hours to get the registration. Okay, I think you all know I don't know, all of you are at different levels of your process, but the process that you do, you need to do your verification. Once you've done your verification, then you'll get an AMC number. Once you've got your AMC number, that means you're eligible to sit the MCQ exam, which you book that through Pearson VUE anywhere in the world, all the different centres in the world and in Australia. And then once you've passed that, then you're eligible to sit the clinical exam. And as all of you would know, the clinical exams are not, to get a clinical exam place is not straightforward anymore. So many times people have applied to get a clinical place and the thing drops out, and there's all different sorts of issues in relation to getting a clinical exam place. But you can do it, okay? We would give you all of the advice we need. I think that I don't want to talk about too much. One other thing I wanted to talk to you about, another option for you too, where after passing the MCQ, is observerships. So I don't know so much what's going on in other states, but I know in Victoria here, we have observerships at Northern Hospital, which Dr. Mandeep can talk to you about, because he was actually heavily involved in the setting up and involved in the observer program at the Northern Hospital. The Austin Repatriation Hospital have an observership. Werribee Mercy has an observership. And Mildura Base Hospital have an observer. These are sort of official observer programs where you'll need to pay a fee. And Monash Medical Centre has an observer program too, but it's extremely expensive. But these are all available to you if that's something that you want to do as well. And we have our own observership, the people who are doing our courses, if they want to do that too, but that's only limited. But these other observerships, and they're all good things if you're thinking about wanting to get into the system. They're all the options. But again, to get into one of the observerships, you need to be a permanent resident. And it's almost like applying for a job as well. So your CV needs to be good, and the more you've done, the better chance you've got of getting into these observerships. And you need referees for those as well. Okay. All right, I've talked enough. I'm going to pass over to Kush, who's the convener of this workshop, and then she'll call the people in. Is it going to be Mandeep next,
Yes,
Kush,
Alan, thank you. Thanks a lot
or
for your
all right,
briefing
all
for
the
the job
best,
opportunities. Yeah.
and nice to meet you all. Okay, bye.
Do you want me,
Bye,
after we
Kush.
finish, is it okay to write down I'll write down our admin's email address. Anything else you want me to add in the chat box about you?
Me, you can do
Yes,
what you like, Kush.
your
Yes.
email address or anything? No,
Yeah,
just
sure, no
that.
problem. No
Okay.
problem, Kush.
All right, thank you. Thanks for briefing on the job opportunities, CVs, and CPD outlines, Alan. Before I hand over to Dr. Mandeep, I'll just take just microseconds, Dr. Mandeep. So he's mentioned about all of those AMC dates, CPD hours, MCQ, and after hours MCQs, the CPD hours and WPA that he was mentioning. That's what we are a bit, concerned about. I've got a lot of questions just before the seminar. After Dr. Mandeep's delivered his part and the two doctors talk, I'm happy to answer all of those as well. You can send me an email as well, and we have a team. They'll be able to answer all of your emails as well if you need more detail about it. I am getting a lot of emails as well. Thank you for the interest, and I'll hand it over again to Dr. Mandeep.
All right, thanks, Kush. All right, so where I will start here would be just one sec. So I can just quickly brief my own summary first, and then we can go through different options. So I trained originally in India. Initially was trying to go to US with US MLEs, but destiny was different. So I came here and I sat the AMC exam, AMC Part 1 exam back in India. And that was after my internship there. And then I came here, did the course, and passed the AMC clinical exam. And then initially I did the observership at Austin Hospital. At that time, these observerships were free. Like now, they're all charging money. But back in those days, I'm talking about 2016, 2017. So those were free courses. And then I got a job in Melbourne, one of the Melbourne suburban hospital, Northern Hospital. There, as Aaron was mentioning, so once you get the first job, so first you will be, so there are two registrations. One is that we will I will talk about the general pathway, the non-specialist pathway, then I can talk briefly about the specialist pathway as well. So I went on general pathway, so that was not a specialist pathway. So once I started working in the hospital, I did my all the requirements of 3 months in medicine, 3 months in surgery, and just like back home in India, I can say that in your internship you are supposed to do certain time in different specialties, like 3 months in medicine, 3 months in surgery or emergency or gynae or whatever. So I did that part, and then I was given general registration. And after that I got onto the physician training pathway, that is 3 years long. So and there are exams at the end, passed those, and then I went onto the training program, the advanced training program, and just finished it. So and I received the letter. So FRACP is the Fellowship of Royal Australian College of Physicians. So this was my brief journey. And then now I can talk about, feel free to ask questions, guys, that helps, especially in the chat box. So when a overseas doctor, when they're trying to move to Australia, back in those days there was one thing that is different now. Like there are quite a few things different, but main thing is like there are a lot of support nowadays with institutes like Allen's. this is the main difference I felt, because if someone wants to prepare for USMLE, there is a plenty of resources. Like, there are question banks, there are a lot of resources where people can choose to, but AMC was not that organized, because if you compare with the overseas doctor going to US and compared to Australia, there is a massive difference. So there are much less doctors and much less, to be honest, like the resources were, and Australia is wide as well, like very big. So so this is the main thing. But now, like, institutes like these online seminars, and back in those days there was no Zoom, no Teams or anything. But now that's good, just to streamline things. In AMC, when you start the pathway, when you finish your internship, again, I will, that's why I asked in the beginning about the audience. So there will be different people at different experience levels. Some may be consultants back home, some may be just finished the internship, or some may be medical students as well. So I will start with the simplest thing first. So once you are thinking of moving to Australia, you need to register with the AMC, make a portfolio there. And you have to complete internship, and then only they can credential you there. Once you got your AMC, then again, if you are overseas, you can try to sit the AMC exam, part one back home, and that will save you a lot of time and money. But different people have different situations. Some people come here after marrying someone, and so they are here, so they can they sit the exam while being here. So, but if you're overseas, and try to do it in your own country. It's a AMC one part one. You don't have to score very high. It's just a pass or fail exam. Okay, and try to complete your English test as well back home. So as Alan was mentioning, then technically you become eligible with just AMC MCQ and your and if you have completed your internship and you have part one. So English part one and your internship. And then then there are two pathways from here. One is limited registration. So you can get limited, you can start working on limited registration with just part one and clinical, part one and English. Then you have to complete your clinical exam at some point while you are working, and complete the requirement for internship about different experience in different specialties, and then you get awarded the general registration. To enter into any specialist program, training program, whether it is GP or whether it is physicians, surgeons, gynae, whatever specialty, you need to have general registration. There is no exemption to get onto a program without general registration, because this is local requirement as well. Here also, when the local people finish their med school, then they are intern, so they also get limited registration when they're intern. So basically we are doing internship twice essentially when we train overseas. So, and then, but if you don't get a job with only clinical, will only written, and then the next step would be to just do the clinical while you're waiting, and then get, so when I got my job, I passed both before getting a job. So there are pros and cons in both approaches, because when you start working, you have less time to prepare. But if you are still waiting for a job, then get this out of your way, so you are all ready to start with your exams. There is no problem with exam, just start working. So this is the overarching idea. With the specialist pathway, there is a very different approach. So if you are a specialist back home, then you can approach AMC, and there is an approach the respective college. So when I say college is a body that accredit you as a specialist. So for example, if you are a physician overseas, then the Australian College of Physicians is called Royal Australian College of Physicians. So if you're physician overseas and want to get yourself accredited here as a specialist, then approach that college. So that should be respective college. Okay. For example, if you're a gynecologist, then approach Royal Australian College of Gynecology or Obstetricians. If you're a psychiatrist, approach them. So that is a very individualized approach. There is no standard rule. There are interviews in specialist pathway where they will interview you depending upon your experience of your work experience and all, your publications and all, and then in that interview they can give you three outcomes. One is they give you three outcomes. One is that you are not comparable, means you are not comparable to the local specialist. Then you can't go further on specialist pathway. Then you have to do general pathway. Or they can say that you are partially comparable, and they will give you suggestions. They will say, okay, you are partially comparable, but you are supposed to do, let's say, 2 years of supervised practice. Then again, they give you limited registration, EPRA, and then you find a job, supervised job, and then once your supervisors are happy with you, then they write to the EPRA, and then EPRA will give you specialist recognition directly. Or the third outcome they can say is that you are fully comparable. That is quite rare. So this is the specialist pathway, overarching idea. Again, there are nuances that everyone is different, everyone's journey is different, so there are always nuances, and that's why we at Ellen, we can help you guys with your questions at different steps. Okay, so I will briefly pause here so this is the overarching idea. This is my journey as well. Someone asked a question.
Well, Dr. Mandeep, I've answered it it was in regards to the exam date that they tried to book. We understand that there's been a lot with the exam date booking recently, and this had happened last year as well and a year before as well. So we've delivered the message to the MC as well. We went for a meeting there. We've written an email as well with all the candidates who've done courses with us. We hope to hear a positive response from them. They've given few dates to few of the candidates, and hopefully they've asked you all to give an expression of interest as well. And they are trying to resolve this matter as soon as possible, and hopefully we do hear a positive response. Thank you, Doctor. If there's anything in regards to what Dr. Mandeep said, if someone would like to ask any questions, please feel free to write down in the chat box, please.
Yeah, I can also add on one more thing with this question, Kush. So basically, someone asked that they're struggling to book the exam. So this is a long-standing problem. This is not new. So the problem with AMC is they have a limited number of spots, and there is not many centers where you can sit the exam. So that is why they are asking for expression of interest to see how many different people want to apply, and then based on that they will give more dates. So this is an admin thing. Should be, this is a long-standing problem. This is not a. Now the other thing here, I can use this opportunity to ask about more as well. One thing is, if there is a alternative for clinical exam as well. Okay, that is called workplace based assessments, WBA. So, but there are very limited slots there. Okay, so you have to actually find the hospitals which offer WBA. But that stretches a lot. Means if you join a hospital that offers WBA in a hope that you can clear your clinical through WBA, then it may take 2 to 3 years working for that hospital. But if you pass the exam straight away, then you are done. You don't have to worry about WBA things. So this is one of the alternatives. Now I'm coming to the question. So Chrislyn have asked, should we apply for limited registration for EPRA before looking for jobs? does it give us a higher chance of getting hired, or should we just wait for job offer then? So Chrislyn, is a simple answer. You cannot apply to EPRA without getting a job. So you have to get a job first, then you apply to EPRA that give me registration. Okay, there are limited circumstances where EPRA can give you registration without a job. So I can give you an example. For example, you are a overseas doctor and you want to do a PhD here, like non-clinical work. This is where EPRA can give you non-clinical registration, but it's very, very rare. So simple thing, you have to get a job, and then the hospital give you contract, the hospital, and they will support your application to EPRA. I hope that answers, Chrislyn. Then next question is it possible to go for general registration process first after clearing AMC part 1 and part 2 and then apply for specialist pathway? Will it give any advantage then directly applying for specialist pathway? So Sahil, this I'm just reading the question again. So is it possible to go for general registration process first after clearing part 1, 2 and then apply for specialist pathway? Sahil, I don't think I don't. You can try. This could be an approach as well. So Sahil is asking, like, if someone is specialist overseas, is it worth they first go through general pathway and passing AMC 1 and 2, getting general registration, then applying for college specialist pathway. Again, Sahil, this is possible depending upon your specialty field, but the only nuance in this situation is when you are a specialist overseas and if you have not worked as a specialist for certain time, like you have not worked as a specialist for more than 3 years, then your specialist college will have issues with your pathway. So they will say that where is the sense of practice? So this is what I can say, but this is possible. This is not totally unreasonable. I know one of my friends who was a anesthetic consultant back home. He came here. He first applied for specialist pathway, didn't get through. Then he applied for registration, general registration, got the jobs and everything, and then he applied again, and then he was successful. Yeah, so you can do that. Yeah, so Kosha put a list of
WBA hospitals.
WB hospitals, yeah. And then who should take PESCI? Okay, so PESCI is exam. This is pre-employment structured clinical interview. So different states have different rules. So PESCI is an exam most commonly taken in the setting that where you want to work as a GP directly after getting your so for example if you go to a hospital, because hospital a lot of hospitals here have got a structured supervision program, so like they supervise their own interns and registrars as well. So if you get to a specialist to a hospital, then you don't have to sit pesky. So you just apply to a hospital, you get a job there, because they said supervised position. After certain time, whatever time you need to pass, then you get your general registration. But if someone get a job offer from a GP, but they haven't, like GP is their first job, then the college wants to ask what's your level of supervision, like what level of supervision you require, and is there someone who can provide supervision? Because in GPs, because GPs are run by, GP is a general practitioner, so they run by their own, so there are very, very limited sources. They are family doctors. So if you want to work as a GP as your first job, then the EPRA wants to make sure that you have a supervisor who actually can supervise you properly. There are a lot of GP practices that are accredited for GP trainees, like local GP trainees as well. So you can apply there, you can get a job there, but or someone may have some connections. For example, their uncle is the owner of a GP practice, and now they have come here to Australia, so they can get a GP job, but then APRA would want a pesky exam to be given. I hope that makes sense. There is another exam. Thanks, Joanne. Next question is, hi doctor, how long did it take you to get a job after passing clinical exam? How did you keep up with clinical recency while doing AMC exams? While doing CPD workshops be sufficient for job applications as I live onshore? Okay, so again, it's a good question. So for me, I got a job within passing the exam. I passed in September 2016, and my first job was June 2017. So at that time it was because my issue was that I didn't want to move to regional, so it took me a bit of time to get a job. So it's very variable, Sydney, about how quickly you can get a job. If you are happy to move to regional areas, then it's a bit easier to get a job there. But if you want to work in a metro hospital, it's again, I'm not saying they are totally impossible, but you can take some time. It can take some time. Now, with the recency of practice, I think the magic number is 3 years. So I was within that 3 years framework, like I was working in India, and so I didn't have to do any recency of practice thing because I was within the 3 years mark. And this is the main reason I'm saying, if you are overseas, then do your AMC and your English there, so that you don't have, and keep working there. It's very, very important. Keep working in back home, so that when you come here, your last date of work is within 3 years of getting a job in Australia. I hope that works, Sydney. But if you are onshore already and you have not worked for certain number of years, again apply to, then it can get hard to get a job, no doubt. So you can so previously, when I used to teach at Allen's, I have given different advices to different people depending upon their situation. Once there was a doctor from Sri Lanka who was here for a while, and then I suggested them to go back home. So they did go back home, worked there for maybe 6 months, and came back and done. So there was no problem with the recency then. But again, this is not possible for everyone. So if someone is here for a very long time, the only other option left will be CPD, or find a hospital that will allow you to work despite having 3 years or more than 3 years break. So what happens is, in this situation, the hospital will have to make a structured supervision program that is called back to practice program. So means, you are trying to now coming back to practice, so the hospital have to give maybe slightly more supervision, but this is still possible. Like, there are doctors here as well, like, who are Australian trained, who, let's say, plan to take a leave from practice for 5 years, or they wanted to pursue something else, and then when they want to come back to the practice, then they have to do back to practice pathway or something.
Sorry, Dr. Mandeep, can I add to this? We recently did a reference check there was an intern campaign going on, and one of the doctors had 10-year gap. She did law while after pursuing medicine. She's been here for long. And then, so I don't know if it's a good idea. So she's been chosen for the intern now.
Yeah. See,
so
like,
there was an intern campaign from Queensland, and I think Tassie as well, where the doctors are getting a lot of, so the doctors who didn't have intern positions or had gaps or something as such, they are all getting jobs there.
Yeah.
If that is relevant to it. For example, Dr. Cynthia had 12-year gap, and she was teaching with us, and she's doing
so they got a
really
job.
well. Yes,
Oh, amazing.
she's in her training now.
Amazing.
Yes.
Yeah, so this
Almost
is also possible.
Yeah, she never went back. But as you say, Alan also suggests to go back, do a recency, and come back. But yes,
If it
that
is,
works as well. You were right.
if that works, you're right. Yeah.
Yes.
Um, Thanks, Kush. Then next
One
question is,
thing like how like recency, like it should be in the last 1 year, and for how long we should have been worked? Like is
so
it like 90 days, something like that?
not 90 days. I think if you have, there is a different level of supervision that will make a difference. So if you have more than 1 year and less than 2 years, that's a different situation. If you have more than 2 years, less than 3 years, it's a different. But if you have more than 3 years of not working, that is
Okay.
that is a red flag. So yeah. So after 3 years of not working,
Mm-mm.
then you have to have re-entry pathway.
Oh, okay.
Yeah, but if you had less than 3 years, then you can justify that what you were doing during that time, and this is where the CPDs can help.
Mm-mm-mm.
You can say that, for this year I have done this CPD, for this year I have done this CPD. So this is what the CPD means, continuous professional development. So there are courses
Okay.
that you can prove that you have been touch in practice. You can show them.
Mm. Yeah, got it.
But a
Thank
lot
you.
of hospitals don't care about this because the hospital, they know that you will be very much supervised.
Mm-mm.
Yeah.
Yeah.
Can I
Agnes,
ask, can I ask a question, please?
yeah,
Is it the same for observership program about the gap?
usually not.
They,
Observation program, they just charge you money and you can get it. But they are getting competitive as well.
oh, okay, okay.
If there are 10 people, because the hospitals, a lot of hospitals do the observership just to see, because the hospitals are keep a constant need of doctors, junior doctors. So they run this observership program just to see, to get good candidates so that they can see how they are performing while observership. So so if there are 10 spots and there are 20 applications and you have a gap of 10 years, then it can be a bit challenging. But if you are in regional, then there are 10 positions and 10 applicants and you are there with gap of 10 years, you can still get it. So it all depends upon right time, right place.
Is it true, Dr. Mandeep? I've heard a lot that you need working rights. You should be a permanent resident nowadays for observership as well. It's becoming really competent, just like a job.
Yeah, it is getting, as I said, it is getting competent, more competitive. So, yeah, they will ask you different, but again, this depends upon, how many people apply. So as I said, when I was there in 2016, the hospitals, they didn't even have enough people to apply.
Mm.
There were no charges. So so now they are charging money, because they can see a lot of people coming now. And when there is more and more people coming, the hospitals will always keep on increasing their standards.
Yeah, because I've seen this, and Alan has been suggesting this as well, that you need to be a permanent resident, which reduces a lot of their paperwork, and they don't have to sponsor. So
Yeah.
one thing we've observed a lot is that they're really after a permanent resident for observership.
And the reason for that is because observerships are mainly in like big hospitals. So,
Yes.
so again, as I said, if you want to work in the metro hospital, it will be hard. It's harder to get a job in metro hospital, but people are getting it. It's not impossible. But if they have 10 people, as I said, with great CVs, so they have an option to choose from, the top. But when you go to regional, um, then they need doctors. Like no one wants to go there, like the local people. So and regional doesn't mean that you have to stay to spend your whole life in regional. You can, once you get your registration and everything, you can come back. Yeah. The whole world is getting competitive, isn't it?
So,
Yep.
so doctor, your best advice, if there is a gap more than 10 years, to go back to their country and what's
Again,
your best advice?
no, best advice is, as I said, there are different situations that you
Yeah.
have. There is no hard and fast rules here. It all depends upon what you can and cannot do. So, for example, if you have kids here, you have to, you can't just go back straight away. You have to plan a lot. So, but yeah. So, if it is possible, then what happens is when you go back and then you work there, then it's easy to justify that. See, I'm working there. My gap is not much, and it's make your CV a bit more competitive as well. But you know if you have a gap of 10 years, then it's the hospital, because they have to work more and no one wants to work more. They have to be very patient with you, and
Mm.
um,
Same for workplace assessment.
yes, yes,
Oh,
yes. So
okay.
gap is a deterrent on your CV.
Mm. Thank you.
No worries.
Yeah, I have a question. I'm from NSW. So last time, like last month, we applied for the campaign, and there was straightway mentioned the people who have observership done will not be counted as a recency. And my situation, I have gap more than 3 years, and currently, actually, it is not possible for me to fly overseas and get my recency back. I was doing some CPDs, and some extent I can feel that they are
Hello.
not, yeah, they can't actually manage that CPD. So what will be the best way? Like Ms. Kaur mentioned about the Queensland program, can we have the detail? How can we go for the campaign for internship program?
Yeah, I can talk about this bit later, about how to find and how to apply for jobs.
Yes, please.
Mac, this is Steve. Could you send us the bank details so we can do the payment for the unguided dive for
Dr.
21st of
Sivaganam, we
Sunday,
can hear you. Would you
21st
please
of
mind
December on
muting
Sunday
yourself?
for 4 people?
Dr.
Cheers. I've
Sivaganam?
sent you an email just then last night. Just give us a
Sorry,
call. Cheers,
Dr.
bye.
Karp. Sorry, Dr. Karpusamy. Would you please mind muting yourself? We all can hear.
Oh,
Thanks. So next question in the chat box is, hello doctor, as a fresh graduate, once we get general registration, what are the requirements to become a specialist? Again, it's a simple answer. So, just like back home, you have to have your training program. So here also you have to do training once you get general registration. So you have to apply to the college, whatever you want to do. And they have their own requirements, 5 years, 6 year, or whatever different specialties. And one thing I can also recommend is, like, if you are a fresh graduate, for now, I think I would suggest all of them to, if you're not working here, just focus on baby steps. Don't think too much about the specialist things as well, because once you are in the system, everything is there. So, you know, becomes very smooth. So just focus on first how to get a visa, how to pass English, how to pass the AMC, and how to get your first job. That should be your priority at the moment. Rest all becomes very smooth once you are in the system. Next is, tell us about medical practice gap. I have completed 3 months as required, but seems it's not enough. Medical practice gap. I have completed 3 months. Dina, I can't properly understand your question. If you are asking that how much you have to work back home to complete your residency, again, it depends upon, there is no magic number I can give you. So it all depends upon how much you have worked. Sometimes if you, for example, if you have a gap of 10 years, I would recommend at least have work experience of 1 year before coming, so that, they can consider your application. Thank you, Dr. Mandeep. Vishal is asking, do you recommend getting some observership to understand work experience in Australia before going for MC2? Again, a good question. So, um, uh, I think observership, I don't see a very strong correlation between doing observerships in a hope that you will be better prepared for AMC exam. Okay. The reason why I'm saying this is because when you are in the, see, exam is exam. You have to prepare in exam setting. You can't just say that that I have seen how the hospital work. I can, because the exam depends upon what questions you get. Okay. And sometimes I have seen people who are actually working in the hospital, they really struggle to pass the exam, because hospital environment is very different doctors, different approaches. And then when you go sit the exam, the examiner wants certain specific things from you, isn't it? So your mind gets a lot more confused, because you can say that, oh, in the hospital they were doing this, but maybe the hospital is, that is not a standard hospital, that they have different way of doing things. So I don't recommend, observership is a great experience, but if you say that, that will improve your chances of passing exam, I mean, some people can get the benefit, but not all. So if your whole point of doing observership is that to increase the chance of passing the exam, I won't recommend that. But it's a good experience to actually get a job, because if you do observership, you may get a job in that hospital.
Thank you, Doctor.
Yeah. um,
Could I
um,
read you the next question, Dr. Mandeep?
Joanne is asking, so supervision level will determine whether candidate should take PESCI or not. No, so PESCI is the exam to tell you about the supervision level. So once you sit PESCI, the outcome of the PESCI would be either you fail it, so they can say that you are not ready to work in the GP, or they can say that you need level 1 supervision, level 4 supervision. So PESCI it's the full form of PESCI is a pre-examination structured clinical interview. So it's like an interview to see how much level of supervision you will require. Okay. So it's a Shri,
Dr. Mandeep, does APRA assessment decide, right, that what's the level of supervision required?
for EPRA. So
But
once you applied for the job in the hospital, once you get a job, the job offer will clarify the supervision level. And then EPRA will just write in the registration, okay, so if this hospital is able to prepare, give this much supervision, then it's okay. So getting hospital job that's why it's easier, and everything becomes very smooth when you are in hospital system. When you are in GP, this is a nuances. I have seen some certain people who has, I think this is what you are trying to refer to, Kush, that my friend who passed the PESCI with level, I think 2 supervision or something, but then EPRA said that no, like we want more intense supervision.
yes.
Yeah, so this can happen, but mainly in the GP setting, rarely happens in the hospital setting.
Okay.
Okay, so hospitals are very well equipped.
Because a lot of people start preparing clinical with us, Dr. Mandeep, and then they're confused. Someone or the other has said, oh, we are happy to give you a job offer for GP. Come on, let's do that.
Yeah.
And then they deviate again from clinical preparation, start doing PESCI. They've passed PESCI, then the supervisor's like, oh, I don't know the complete procedure. Then it comes back again. Now they've had a big gap of 6-7 months. They've stopped preparing clinical. They thought they'll do GP, and then again they're like, I always try to tell them, please stick to your clinical preparation. The hospital setting's the best. There are hopes being given that we'll give you a job offer, because they are desperate for a GP, and the students are desperate for a job, and then they end up not preparing for clinical. So please be sure if I am correct here, as Dr. Mandeep.
Totally, Kush. I totally agree with you. So that
Yes.
happened with me as well. Because what happens is GPs are family doctors, they're a group of doctors, and and there is a lot of patients. If I'm a specialist, only people with cancer comes to me, not everyone, but GPs, everyone goes to them. So they're very busy and they always are looking for doctors. Um, and it's very easy to give a job offer to anyone from GP. Okay. So don't get flattered or don't get too excited once you get a job offer, because once you get your registration, then every door will open for you. Okay. So I have seen people, instead of focusing on AMC clinical, they start giving PESCIs, keep failing on PESCIs, and then they waste a lot of time. Okay.
True,
Yeah. So
Dr. Mandeep. In
yeah,
every group, there's this happened. And sometimes they don't even share that I've got an offer, because they're excited that I've got an offer, maybe I've got a connection, and then it's a long-term loss they have of money and time. Time is
exactly.
really precious for them. Yeah.
So focus on, guys, you only need 1 to 2 years. if you apply for remote regional areas, they're always looking for doctors. You don't have to worry too much about. And plus, the other benefit of going to a hospital is that, means once you go to a GP, it's very, very hard for you to come to a hospital after that. Okay, if you want to do a physician or surgery or something else, then it becomes almost very difficult because you have a mortgage to pay. Then it's very hard to switch. But if you have already experienced the hospital, you know what hospital like, and you can decide is it for you or not. If not, then just go to GP after that. So this is the thing I suggested in the very beginning, saying that if you get a job, great. If you don't get a job, focus on clinical, because you can't imagine how great it feels. Means started working with all your paperwork done. You don't have to worry about preparing. You can enjoy a job actually, and enjoy what the money will you will earn. Otherwise, all your money will keep on going to exams and all, and you're always stressed out. Yeah. So if possible, um,
Is it possible for us to get a GP level 1 supervision job with 2.5 years of experience post internship?
it is, but again, pesky will decide. Okay, it's not impossible, but and one thing I can also clear is that, guys, GP in Australia is very different from GP back home. So, for example, in India, there is no counterpart of GP. There is no GP here is a specialist, like a proper specialist. Okay, so when you say that level of 2.5 years of experience post internship, I'm not sure what experience you have. And this is the main reason a lot of people fail pesky, because GP, they are looking as a potential GP, and back home there are not many countries where there is equivalent health system where you are a specialist community people. Okay, so be very careful about when you apply for GP jobs for your first job. First job, if you get a hospital job, then do whatever you want. But yeah, it's a yeah. So pesky can decide your GP level.
Can we do observership in a workplace based assessment recognized hospital and
if they are available, apply if they are available.
And get clinical done with observership, or we have to have a job with the hospital?
Sorry. So can we do observership in a workplace-based recognized hospital and get the clinical done with observership? No. So work-based assessment is actually clinical experience. So what happens is, once you get your work-based position, then you will have regular assessments. You have to have a supervisor. So you can't do WBA with observerships. I hope that.
The next question, it's about the CVs. We always say about the APRA, there's a format that they have. That's the basic APRA format that they're looking forward to from you. Sorry, Dr. Mandeep, if you don't mind me answering that one, but that's the example, but he's applied for the job, so I'd let Dr. Mandeep talk about it. Can you share some good CV examples? Which area, teaching, recency of practice, research should we focus on building?
So are you asking me, Kush, or?
Yes, Dr. Mandeep.
Yeah, no, I agree. Like APRA format is fine. One thing is, again, guys, when you are applying for a job in a hospital, in most circumstances, you will apply for a junior job. Is that right? You are not applying directly for a consultant job. So don't try to make your CV look like that you are a consultant, or means I have seen people filling their CV, making them like 5 to 6 pages. No one have time to read it. They know that you haven't worked in Australia. This is your first job. They know it. And don't worry about too much about local references as well. I know Alan was saying that he can help out, but like when I got a job, all my references were overseas, and one was Alan. So don't worry too much about this thing. So Alan may have been referee for maybe almost 10, like 5,000 doctors. So and you are applying for a intern or a HMO position, so keep your CV at that level only. Main thing they're looking for is gap. This is the main thing they're looking for. gap. Where did you do the degree? Then CPTs. Don't fill the page with like hundreds of CPT courses, because you don't actually need them. um, and your references and your work experience, and also you can write, if possible, you can write work experience. So you can write, you know have experience in plasters, putting plasters on someone's leg, cannula, putting a cannula in. This is what they expect from HMO or intern, isn't it?
When
They
it
don't
got
expect, yeah, they don't expect a cardiac surgery from you. So just be a bit reasonable, and yeah, and keep it short and in EPRA format, as Kush said.
I think basic things are looking, they forget to write about history taking, physical examination, or Dr. Mandeep, if they've come from a highly crowded, good volume hospital, at least just mention that there were 10 ICUs,
Yeah.
and you're most concerned about stabilizing a patient.
Yeah.
Yeah.
And always be proud of where you come from, guys. So don't downplay where you come from. You may have done your MBBS in much better hospital, than much better experience than maybe you're still in hospitals. Okay. For example, if someone have done in back home in India, we have AIMS, so All India Institute of Medical Sciences. So if someone have done MBBS there, I don't think so there is a matching hospital in Australia. So don't downplay your thing as well. So okay, if you have a great hospital where you have worked from, glorify that as well.
There was a question that's down below, but it's related to this. Dr. Mandeep, they were asking, should we only write about hospital work or some other work as well? It was in a hospital setting. I think it's a yes, that they should
Yeah,
write everything. Yeah.
exactly. So whatever work experience you have, you write that. Okay, but make it very clear and succinct.
Doctor, can I ask a question, please? Does the clinical exam, if we pass the clinical exam, give any benefit about the gap? Because I passed the clinical exam, so they know that you can deal with cases with multiple. Does it give any benefit or no?
It improves your chances of getting a job, but gap is a gap. So if you have a gap of more than 3 years, but as I said, everyone gets a job, so don't think too much. So you still can get a job.
Okay.
Next question is very important. How did you find your first job, and did you send CV directly to the hospitals? There are not many offers for IMGs in the job pages. Okay, so I was waiting for this question. So one thing I can make it very clear for everyone, guys, there are Facebook groups, or there is a lot of negative things going on in the social media as well. And I'm not sure, but 8 years ago, when I was in your position, there was Facebook groups where everyone will say there are no jobs in Australia, people don't like IMG doctors, and I'm pretty sure you guys are also exposed to those bullshit. um, and human mentality is that you will go more towards negative news than positive news. But one I can reassure you that in my batch, in my when there were almost 30 doctors preparing for AMC clinical in my batch, and out of 30, 28 have got jobs here. Two decided not to come to Australia due to different reasons. But if someone wants to live here, and all of them are now doctors, some are specialists, some have gone to GP. So always be positive. If you have decided to come here, then one day you will be successful. Okay, someone can have different time frames, but if you have already made up your mind, then it can take some time, but it will work out. Okay, and it's not easy journey, guys. No, you don't have money when you come here. It's not easy journey. But once you get there, then everything becomes pretty good, and then you forget about your struggle. And this is the main problem. When someone gets successful, they don't post a lot in that groups. Only negative people write. So when I passed my exam, I wrote a big note in that Facebook group that, guys, I have passed the exam, and if I have passed, everyone can pass. Okay. And even when I got the job, I posted there that there were 100 people saying that you can't get a job, and then I got a job. Okay. Now when I was applying So I got actually lucky. So not lucky, now we can say retrospectively, but I got observership at Austin. Then I got an observership offer from Northern Hospital, and somehow from the assessment from Austin Hospital worked for me to land a job in Northern Hospital. So this is how it works, and you only need one job. Once you are through. When I used to apply for jobs, so I always tell when I was teaching in LNs as well. So I used to maintain a list in my computer. So what I used to do, I will say hospitals in Victoria, public hospitals in Victoria, public hospitals in New South Wales, public hospitals in Western Australia. Make a list, okay? Make again, promise me, guys, you don't waste time on this when you are still preparing for AMC clinical, because otherwise I know a lot of people will get excited about the job things. So focus on clinical if you can. So I made a list of all the hospitals, their medical workforce. So Sophia have written that there are not many offers for IMGs. No hospital will write that we have reserved some jobs for IMGs. Okay, no hospital will write that. You are competing with local people, okay, and you get a job once they are out of local people. This is fair enough, because the government has spent so much money in local training local grads. They will prioritize them, okay. So and then once whatever jobs are left, then we are there, but there are plenty of jobs there. So I used to maintain a list, and then medical workforce, there is a generic email addresses for medical workforces. So I used to call the hospitals. I used to email my CV and expression of interest every month. So hundreds of hospitals, and I used to maintain, okay, last email sent on this date, next email sent in next week. So this is what I used to do, but I had so much time because I was teaching at Allen and I passed my clinical, so I had plenty of time to do this thing. But but this is how people get jobs. You just can't imagine. You just can't, if until and unless you are the luckiest person in the world. You apply and the next day you get an offer. A lot of people have to apply for a lot of jobs and don't get disheartened if no hospital respond to your email. You keep on applying to them. As Alan was saying, they are not after you. You are after them. Okay, so don't get disheartened. It's a process. Everyone goes through it. So keep on applying. There is no other way. There is no easy way. Okay, I used to call them. I used to visit them as well. So just do that. Someone asked, Andrew Pradeep, hello doctor, I passed my MC clinical May 2025, have been applying for jobs since. Unfortunately, I haven't been able to find a lot which I believe is not having a hospital experience. I'm starting hospital job in India in January. Is there a particular department I should prefer, so increasing my chances? It's good, Andrew, Pradeep, that you are going back to India. Again, go regional. Now, in Australia, the clinical year starts in February of a year. Okay, so all our training programs or surgical programs or all the hospital programs start in February. Okay, so all the jobs are from February to February next year. Now, the reason why I'm saying is mid-year, so February can be a bit of hard time, like first 6 months can be a hard time. But as I said, keep on applying, guys. Keep on applying as much as you can. Keep on calling them. Okay. Sometimes what happens is a doctor quits suddenly. So the medical workforce is desperate to find another doctor. And then, you happen to be the right person at the right time. Your CV is in front of them and you are calling them that I want a job. And they will say, okay, come on, let's interview you. And that's it. And as I said, May 2025, and we are still in 2025, mate. So don't stress too much. This is a normal process. Okay. So, and I can't say that you work in any particular department. You just gain more and more skill wherever you want to work, and keep on applying. Okay.
Okay, thank you.
Who is Andrew? Sorry, Bhavna, Doctor for Specialist Pathway. Have you any idea regarding anesthesia? Is 3 years MD degree with 3 years experience post graduation from non-comparable health system? So Bhavna, are you a specialist back home? Anesthetic specialist?
Yes, yes.
Yeah, so you will have to ask. I don't want to give you wrong information. You have to ask the College of Anesthetics and I think Critical Care Medication, CICM in Australia.
Okay.
You have
Okay.
to deal with them because I haven't dealt with them, so I can't. If I don't want
Okay.
any wrong information. So
Thank you.
there
Thank you very
are
much.
specific colleges where you contact them, email them. They're busy people as well, so they will take their own time.
Yeah, thank you very much.
Hi, Dr. Mandeep. Would like whether you would recommend going back to Hong Kong to practice internship or observership in Australia as someone who has just finished M2 if you want to work home. Well, it depends upon your gap, Mathia. So if you don't have much gap still, just keep on finding hospital, keep on applying for jobs, and if possible, try to visit the hospitals as well. So I would say just keep on applying, mate. You have done both your jobs. If you don't have much gap, just keep on applying jobs. Can we have more examples of hospital where it's easy to have intern jobs? Guys, I think again, you have to find hospitals yourself. But when you enter a hospital, you will realize a lot of doctors are there already, IMGs. This is one thing I can reassure you. My question, if you have logged out 16 months prior to passing MCQ, moving here, marriage and doing interview of now 48-year-old married living in AU, will the gap age gender matters to find job after passing? Kindly give advice and insight of what is the best option back in the country of my origin. I have 13 years medical practice until December 24. Well, as I said, you have to apply as much broadly as you can. So hundreds of hospitals. I can't say that you apply to this hospital and you will get a job because I also didn't get a job like that. So you keep applying repeatedly, keep on sending your CV again and again, keep calling them, and one day you will get a job. Hi doctor, does your center helps us get visa if we book clinical exam? Kush can answer this.
So Dr. Ravi, is it Ravi?
Yeah.
Dr. Ravi, we do recommend you or help you with a offer letter. If you enroll in a clinical or MCQ course, we give you offer letter which says that you've been enrolled with us for 10 weeks clinical course, and these are the workshops that you'll need hand-on training. For example, if it's fracture management, physical examination, ECG, women health and communication. So there's all demonstration required, and then that supportive letter helps you a lot with the visa. Usually the students come on student visa. That's up plus 600 or 100. A lot of students do public health, but that's a lot of another investment of money as well, which gives you a longer visa. So it entirely depends on you. We don't help straight away, but we can help you with the letter that you need to come here, a supportive letter that you need for your application of visitor's visa. So visitor's visa is something that mostly we've seen doctors coming on and arriving here.
Yeah, thanks, Kush. Next question, someone asking that, does the gap means you're not working as a doctor? I would say yes, that is a gap. What if the example one is working in a hospital here in Australia but not as a doctor? Well, that is not a red flag actually. If you're already working in a hospital system, it's actually that gives you a good perspective to the medical workforce that, because everyone knows people need money to live and need to work to live to earn money. So I don't think so. This is a red flag, but gap can be concerning. So you can say that, see, while I'm working for this, in your expression of interest, you can write, while I'm looking for jobs, I am working here in this hospital. Wherever hospital you are working, try to approach their medical workforce and say, knock knock, I'm here working as this and this. Do you have a position for a doctor? And a lot of hospitals, they're very nice, most of them, so they will look after you. Want to know job opportunities after 8 years gap and doing mental health addiction 5 years in New Zealand. Recently passed clinical, had around 15 for junior doctor position. In New Zealand, I have done observation in GPs and care. Well, 20 rejections are not many, Chrislyn, I would say. So they're not many. Okay. So when you reach maybe 100 rejection, then then we can think of, but 20 are not many. At
That's
least,
all I
so,
learned today.
yeah, when you say rejection, did they actually reply back to you?
Yeah.
So 20 people have replied back to you saying that they, but that's not bad because actually they are taking time to reply to you. When I
So
was,
they don't. Okay.
they don't even reply. They don't even reply. So I would not say it's a positive steps actually. So people are actually taking time to reply to people.
We had Dr. Eriko, Dr. Mandeep. He said I got 20 rejections every day, and which he thought was really positive. And then he applied 100 of jobs, and he's working now. Everyone started working. That's the hard work. That's the key to it. We have to keep applying. But everyone's getting jobs, we've seen. And yeah, Dr. Mandeep is in front of you, and we've got so many IMGs as well. There were two other doctors waiting as well. One of them is waiting on registration. I guess she wanted to talk as well.
Yes, you're right, Kush. I totally, as I said, 28 out of 30 people in my batch, they are working and they have even forgotten like their IMGs. Does it make any difference taking part one exam in any other available center overseas or better do it in Australia? No, it does not make any difference, I would say. So, Ruby, if you're asking this, it all depends on your preparation. Prepare well. I sit the AMC part exam in India, in New Delhi. So,
Sorry, Dr. Mandeep, we'll be aiming to finish it by 220 or 222.
okay, no worries. I will be very quick. Yeah, 4-year clinical gap in my. I think I have answered this as well in some part. Are there any observation program that are recognized by APRA? There are. I think Monash. Have a look. Udupit. Look at the Monash website, Monash Hospital Victoria website. I think they do have a some supervised program or something, but as I was mentioning, very expensive. I'm not 100% sure that is recognized by APRA. So have a look at Monash website.
I checked with them, sir, and they told that with the 3-year gap, it is difficult to get into the Monash program.
Yeah. So go regional, mate. Go more regional. If I may ask, last time, suggest approach or job search, which I think I have answered this question. If I'm another question, what job should be by unaccredited trainees, SRMO? So apply for all. So unaccredited trainees. So SRMO is like a registrar role. In some areas like Queensland, they call it as SRMO, but in Victoria, they call it as registrars. Apply everywhere, as broad as you can.
Thank you, Doctor.
If you become volunteer in Australian health system, CPD would no. Sri Satriya asked if you work as volunteer, will that count towards gap? No. Ravi Khatkar, thanks. So, hello, 12 months and 20 minutes to complete because I took 8 months break internship, which my concern is whether this non-continuous 8 months gap. No, Pavan, no. Your gap of doing internship will not cause any problem because we are all human beings. People can have different things in life, and people can have gap for a reason. If you can explain the gap very well, no one cares about as long as you have completed your internship. In terms of practice, presence clinic, strictly hospital practice that is recognized as well. No, any experience there, mate. If you can justify any experience working there. All right, I think.
Thank you so much, Dr. Mandeep. Doctors, if you have any other queries, please send us an email and we'll surely make sure that you've been answered for all of your queries. I will note down the email here as well. I'd like to really thank Dr. Mandeep Dr. Mandeep. It was great to have you. It's an honor that, they've been able to ask you and you've been able to answer us. It's really the doctors have that much of time to give back to the community. We have thousands and thousands of doctors who do courses with us. They pass, as you said, we've lost contacts with them. But thank you so much for giving it back to us today. And I just can't quote it in words how we can thank you for this knowledgeable
All
session.
good. All good.
We'll try to do them regularly, and I'll try to get it more in a better way, have a pre-survey, post-survey where they can all have their questions. And as well now, I'll give them more information about the courses, workshops, CPDs, or anything else they'd like to know. Thank you, Dr. Mandeep, for coming on
All
board.
good, Kush. All good. Best of luck, guys. Just keep.
Thank you.
Thank you. Thank you so
I'll
much.
just take another 2 minutes for all of you. And if there's any CPDs or any courses or anything online that you're concerned about, from Epic till job concerns, you can write down us queries here. We are happy to help. And you can even, send email if you want to book an appointment with Alan or any of our tutors. We do have consultations available as well if you'd like to do that as well. If you're after continuous professional development, if you're after referees, there are a lot of our course candidates I've seen, they've joined there. You will have Alan as a referee. And trust me, if there's a campaign going on, we are doing 2 to 3 reference checks every day, and they do contact us as well. Hey, Kush, we've got an interview here. Do you know any questions? What's happening there? So currently we know there's a lot of Grampian, there's a lot of interviews going in Grampian, the Eastern Health. So they're giving a lot of intern positions as well. So that's how we are always up to date as well. Stay in touch, send us emails, inquire until and unless we don't know what you're really looking forward to, we won't be able to answer you. So please approach. Thank you, Dr. Mandeep. Thank you. And if you wish to send us emails, if you would like to ask more about the pass rate, or you'd like to know more about the courses or any workshops, or would like to refer a doctor who wants to know more about Australia, send us an email, a detailed, we will make sure we answer you in detail. If you have any questions about exams, passing exams, booking your exam dates, apart from the doctor's point of view about admin, you can please ask me. I have another 6 to 10 minutes, which I can answer you. I think all good.
Dr. Kush, I have one question.
Yes.
So I have not got a job offer yet, but do you recommend I should apply for a visa, a work visa, which I'm also able to apply for through the specialist thing from New Zealand? So do you think I apply for a visa, then apply for jobs like simultaneously? Would that help?
Yes, definitely. So I'll come here with the CV approach. So if it's your CV and you write, I have full working rights. I did one of the Japanese doctor's CV just a few days back. He's only done MCQs. You can have a look at the Instagram handle of ours. The point that made a huge difference was he had work visa. He had full working rights. He's not past clinical yet. He's got the job. Okay. Please make sure if you have working rights, write it down bold. I do see CVs and they've not written that I'm a permanent resident. And I do see that they've not written I have full working rights. Write it in bold.
Okay, I'll do that then. Thank you.
Yes. And if you've done Alan's course, write it in bold. You've done a 12 weeks Rimgasa's course, which given you CPD points. They do ask Alan for reference check. We do a 2-paper reference check where they ask you how was her work ethics, how was she in the course, was she responsible, would you like to employ her back again? So do add him as a referee, or any Australian referee is good to have in your CV, and your other referees from your country town as well. It's really important. This shows that there's no problem in when you'll be working in your own country, that yes, we can contact them there as well. It's just they try to approach the Australian referees a lot. We've got a lot of calls sometimes. There's a hospital in Montague. They were like, oh, we are getting so many resumes of yours. What are you guys doing and all? And a lot of our doctors are working in the workforce. So please write down what all you've done. Yes, he was correct. Don't write too many CPDs what you've done 5 years back. keep it up to date. Do your ELS, do your BLS. Have the ALS in your resume. What another thing is important, if you've done some volunteer work, you've went to rural areas, done some free checkups there, please write it down. Just one line is enough. They love it when you write community work has been involved. If you've done emergency, highlight it. Someone asked that what is it that really makes an impact? Emergency as well, when you worked back in your country, and we write it down that I've handled high volume 10 ICU bedded emergency. I was doing ward rounds. I was on night shifts. Please include these things. I've seen the doctors do tend to forget all of that. Try to keep it in one format, one font. The spacing should be correct. They really want you to present professionally because they love the professionalism while they're working as well. Working here gives you an exposure, so that's good as well. A few of the doctors were saying that doing observership would really matter. It's good. It's a good exposure for you. Anything else you'd like to know? Please feel free to unmute yourself and ask if you want to. I've been working with Alan for 9 years as well now. I am not a doctor, but I've been through a lot with the doctor's journey. I know a lot about registrations, pesky, all sorts of pesky, and what all you will be going through. There'll be a wait after you've got a job as well while you get registered with the hospital. So the registration goes in conjunction with the hospital. Till you don't have a job offer, you can't go ahead with registration. You'll definitely need to do it in conjunction with the hospital. The hospital will be the one asking you, okay, get this good character certificate. When you come to the point of getting to good character certificate, means you're really near to getting your registration now, because you're being appointed a registration officer. Then they ask you for a few more documents, and I think nearly to the end is getting a good character certificate from where you worked. So that is when you contact back your country and get that done as well. Everything's possible. We've got people who had 12 years gap. I know a lot of you might know Cynthia. We've got people who had 10 years gap, 17-year gap, 13-year gap. It's not a big deal. Everything's possible. The only mantra is to apply. I've seen doctors, they say, oh, Kush, there was no advertisement for the job opportunity. You don't have to look up for that. You have to just apply. La Trobe Regional, Ballarat, Bendigo, Launceston, Burnie, Tasmania. Then you've got Gosford, which is a really IMG-friendly hospital. Then we've got St. John of God. We've got so many hospitals. Please make a list like Dr. Mandeep said. And yes, first in your 50-kilometer next to you, they really like someone who's near. We've had so many cases because I've been there every day, so I know that these things have happened. There was a doctor, she was in Ballarat. She walked, Alan said to her, I never believed this when Alan used to say, walk into Ballarat, oh, you're staying near it. And then she did go there, and they had interviewed 10 doctors, out of which 8 did come back, and 2 said that they would have got interviewed somewhere else as well, and they would have loved those hospitals. They said, oh, you tick all of our boxes, let's interview you. So there are vacancies, and please apply. The intern position as well that I was talking to you about, the Eastern Health, there have been a lot of doctors of ours who've got jobs there as well. And we are doing reference check every second day, every third day. I don't know why there's a lot of negativity being there that there's no job, even clinicals don't get job. Pradeep, I want you to talk to me, please. I've heard your message. You've done clinical. Please send me your CV. I know you have, but let's talk. Where all have you applied so that we can help you there too, okay? And I want to see which CPDs you've written. If you're listening to me, I saw your message. Please send me your CV again. Let's have a look again and go thoroughly where all you're applying, okay? Thank you, everyone. I hope this has been helpful. And if you need any more information about the courses, workshops, or anything, I've been able to help the doctors if, at times they want to go on installments and some sort of discounts as well. If you want to refer your friends, family, anyone, please send us an email, okay?
Yeah, sure. Thank you.
Thank you. Hello, Kush.
Thank
Would you like to
you.
ask for the visa if we use the visitor's visa to do? Yes, out of 100 doctor, 90 doctors come on visitor's visa and to do the clinical exams, and we pass to find a job with visa. So what happens with that visa after that is they sponsor you and they give you a work visa. So the hospital sponsor you. Out of thousands of doctors, 999 get sponsored by the hospitals. Only a few are PR and Australian citizens. So yes, thank you so much. I approach towards doing such seminars very frequently. Yeah. And we have a Telegram handle, we have Instagram, we have Facebook. Please join us there. We've got a lot of information that we do put there as well about job opportunities, about clinics, which do contact us, sometimes me, Alan, and they are looking for GPs. If there's someone who's supervision 2, supervision 1, DPA, a place where there's an area of need. So please send me your resume or send Alan an email if you're looking forward to. And if you've put him as a referee, always send us an email. Yeah. Thank you. Thanks a lot. I hope this has been helpful. Best of luck, everyone, for your journeys. I hope to see you all next year. Happy New Year. Thank you.
Thank you.
Yeah.
Thank you.
Dr. Yazin, you want to say something?
No.
Thank you.
I